our best practice is on shoulder impingement.
So what is it? So shoulder impingement is also called subacromial impingement syndrome, and it's characterized by shoulder pain that increases with elevation and overhead activities. So predisposing factors for subacromial impingement are rotator cuff muscle weakness, muscle imbalances, capsular tightness or laxity, dysfunctional kinematics, inflammation in that subacromial space, and then like an anatomical predisposing factor is if the acromion is hook-shaped, it can cause some impingement in there. So mechanism of injury, it's usually an insidious onset from overused repetitive activities, so something kind of like baseball or swimming, you see it a lot in. So this is just a visual we had to kind of show you what is actually happening in that subacromial space. So the supraspinatus tendon, and then that's the long head of the biceps tendon coming in, and then the bursa sits in there as well. So if that space is decreased due to any of those reasons, you're going to have that impingement and that pain.
So some of the signs and symptoms, they're going to have diffuse pain, mostly like anterior or around the acromion. The range of motion, usually with overhead athletes, they will have an increase in external rotation and a decrease in internal rotation. They will be achy after the activity. Sometimes if you warm them up enough, they can decrease their pain. Point tenderness over supraspinatus and long head of the bicep. So if you palpate anywhere, it's probably pretty tender. Pain increases with abduction and is worse at 90 degrees. Also pain with full flexion, and that's when that acromial space is like the smallest because it's kind of compacted in that position. Visible edema, sometimes you can have some swelling that you can see. Possible atrophy of the surrounding muscles, so if we're not strengthening because we're in pain, then we can see a little bit of atrophy in the other muscles. And then rounded shoulders, so this upper cross syndrome that we've learned quite a bit, the inhibited neck flexors, the inhibited rhomboids and serratus, and then the tight pecs and facilitated upper trap and levator.
So some special tests you can use and do for shoulder impingement include various ones like the drop arm test. Remember, it's going to be a controlled drop until they get to 90 and then it's just going to be uncontrollable. As well as the empty can test, the Hawkins-Kennedy's, the Nearest test, Speeds test, and Jurgensen's. We included the Speeds test and Jurgensen's because although it focuses on biceps tendinopathy, you can still use it in impingement tests. And then the population for shoulder impingement ranges from the most obvious like baseball, swimming, all the way down to track and field and golf. And at APU, acrobatics and tumbling.
Oh, no. So this is a video.
Great. I think you need to go again.
Can you send that in here?
Should I talk about it? Yeah. So this is one of our baseball athletes, and he is an outfielder. And he came in presenting with some anterior shoulder pain, impingement, and we have been doing stabilizing exercises. We've been doing a lot of movement, mobilization with movement, all that kind of stuff. And he's feeling some relief, but he felt the relief throughout the day, but then he was still having some pain with his throwing mechanism. So we filmed his throwing, and we noticed that when he is going into a extension position, he is up elevated at it. He has facilitated upper trap.
Okay, here we go.
It's slow enough. So it's upper trap, and then you can see his scap kind of like protract also. And he's definitely an overhead thrower. And so he was having that pain right here, and then we also talked to Sean because he's a baseball expert. He also said that he doesn't kind of follow through with it. So instead of coming up and then just staying here, he needs to kind of follow through with his arm. So, next one. So this is another one of our athletes that we were kind of comparing both of them together. So he throws more of a sidearm, but as you can see, his scap is positioned pretty much downward. And so his upper trap isn't up like this, and his shoulder isn't kind of in that impinged positioning. And he kind of throws sidearm, but he's also a pitcher. So he knows a lot about it, but we've been working with the other outfielder with this positioning, and he's seen a lot of relief with that. So we were doing all these stabilizing exercises and then now fixing his throwing mechanics, and he's seen a lot of relief.
Kevin? No, Kevin, you can't sit there. Kevin, you can't sit there.
Can I sit right here, Neve?
There you go.
Just let me walk over here.
So looking through research, what they kind of show as like evidence-based treatment as ways to treat shoulder impingement, they look at rhomboid and lower trap activation exercises, just kind of generally. They didn't really list any specific ones. Also soft tissue mobilization, and they recommended using like friction massage, which is something that we haven't really used in a clinical practice, like trying to treat shoulder impingement. And then joint mobilization to stretch the capsule, and then also mobilization with movement, as well as motor control exercises trying to control the scapular positioning.
So as we all know, obviously with soft tissue mobilization, we know that the tendons are already kind of inflamed. So doing a friction massage would probably make it worse because we would just be adding more inflammation to that area. So this is the clinical treatment that we think it should be used with shoulder impingement. So what we want to do is use instrument-assisted soft tissue mobilization, so using like a rock blade or hawk tools or anything like that on the facilitated muscles. So those are like upper trap, we've worked into lats a little bit. So we want to kind of release those so we can get that scap, or give the ability for that scap to get in the correct positioning. And then we have some scapular exercises. So this is kind of the progression that we want. We want to use the instrument-assisted soft tissue mobilization, and then the scapular exercises, and then we'll go over the rock tape after. So the first exercise you want to start out with is pro 90-90s. So you'll lay with your head here. You can have their chin supported on the table, and so that they're not like extending their neck back. They're gonna have their arms out to the side. Right there, another arm too. Good. And so what they're gonna do is retract here, and then come up, and then back down. Good, and down. So you can cue them here, and make sure these are off. So we wanna bring shoulders down, cueing here. Good. And then we all know IYs and Ts. We should know them. Just making sure that the scap is depressed and retracted. Wow, impressive. Banded rows, so he would be standing, you would get correct positioning of the scap, and it's just normal rows with a band. Banded extension pull down, same thing, kind of getting more of that overhead activity. And then overhead 90-90s, so go ahead and stand up. So this one is with a band, so I'll be standing, so scoot up. I'll be standing behind them with a band. They're gonna first start out with a kneeling, with a half lunge, yeah, good. So this, and they're gonna do internal, external rotation. So what we wanna do is keep the elbow down, good, turn these muscles on, good, core is on, obliques are on, good. And then we can progress them to lunge. So there you go, that positioning. And then position specific banded D2 pattern. So D2 pattern is here to here. So we put a band in their hand. This is like progressing a little bit farther. And they're gonna go through that D2 pattern. They can do it in that lunge position also. And then side plank with threading the needle. So this is like total like scapular stabilization. And we can do this a lot earlier on by just holding the side plank just to get that stabilization of the scap and down here, good. And then you can progress them to threading the needle. So you'll kind of do the twisting motion, good, and making sure that this is on the whole time, good. And so yeah, so that's super like stabilizing that scap and getting them to move on other parts of their body. And then archers, oh, you didn't give us permission.
I do.
Okay. So these are what archers are. So you need the little slide boards. And this is like extreme progression. Once they feel like no pain, this could just like be like maintenance. So just try to get them stronger and better.
No, Carlos.
And then, go back. not really to like put them in the correct position, but to remind them of the correct position. So you want your patient to be sitting in a good positioning of their scaps, no pain in that position, and then what you're trying to do is reinforce that position. So you're gonna put the tape starting up here in the front, the anterior shoulder, and it's gonna go back in there so that when they start to slump down or they start to get this positioning, they have a reminder of that tape pulling on them.
Maybe you'll cover this, but like as far as steps and reps on those scapular exercises, what are you thinking on that?
Yeah, so I like to do till fatigue and then like 5 more. Because we don't want to keep them going once they've fatigued, because then we're just doing reps just to do reps. So once you see the scapula starting to fatigue, you see the upper tract starting to activate, then we want to give them a break and then start over. And that'll kind of gauge like how many reps and sets you can do.
And then after all that treatment, how are you gonna know if it worked? You can use the patient-reported outcome for the upper extremity functional index, and it ranges from 0 being extremely difficult to 4 being no difficulty. And you'll just ask your athlete their difficulty level when doing doing activities such as driving or anything like any homework, as well as if you were trying to put on your clothes, to bending down, anything like that. And this is a very likable pro for all of us.
Yeah, because it's simple. It's only 20 questions. So if you wanted to use it daily, you could, just because they'll kind of know the questions and see if it gets better over time. That's it.
And that's shoulder impingement.